Assalamu alaikum, welcome to Pediatric Case Review. In this episode, we will dive into the presentations and the diagnosis of nephrotic syndrome among pediatric patients. Let's begin. Case number 1. A 7-year-old boy presents with significant periorbital edema and decreased urine output. His medical history is unremarkable and there is no family history of kidney disease. Lab tests reveal proteinuria and hypoalbuminemia. Which of the following best explains the pathogenesis of this condition? A. Decreased production of albumin in the liver. B. Increased permeability of the glomerular filtration rate. C. Obstruction of urinary outflow tract. D. Overproduction of proteins in the bone marrow. The correct answer is B. Increased permeability of the glomerular filtration barrier is the primary pathogenic mechanism in nephrotic syndrome. This alteration allows proteins, especially albumin, to pass into the urine, leading to proteinuria and hypoalbuminemia, the hallmark of nephrotic syndrome. The choice number A, decreased production of albumin in the liver, is associated with conditions like liver disease. And the choice number C, obstruction of the urinary outflow tract, typically leads to symptoms like pain and hydronephrosis. For choice number D, overproduction of proteins in the bone marrow is more related to hematological disorder. Case number 2. A 5-year-old girl brought to the clinic with swelling of her eyelids and ankles. Lab findings include significant proteinuria and low serum albumin levels. No systemic diseases are identified. Which etiology is the most likely in this case? A. Diabetic nephropathy. B. Minimal change disease. C. Amyloidosis. D. Urinary tract infection. The correct answer is B. Minimal change disease is the most common cause of primary nephrotic syndrome in children and is characterized by significant proteinuria and hypoalbuminemia without systemic disease. Diabetic nephropathy, choice number A, is a common cause of nephrotic syndrome in adults with long-standing diabetes, not in younger children. Amyloidosis, choice D, is rare in children and usually associated with chronic inflammatory disease or familial syndromes. Urinary tract infection can cause proteinuria but usually doesn't lead to the significant proteinuria and hypoalbuminemia. Case 3. A 9-year-old boy presents with generalized edema, fatigue, and weight gain. Investigations revealed proteinuria above nephrotic range and hypoalbuminemia. His blood pressure is normal, and there is no evidence of systemic disease. What is the most likely diagnosis? A. Idiopathic nephrotic syndrome. B. Glomerulonephritis. C. Hepatic cirrhosis. D. Congestive heart failure. The correct answer is A. The clinical presentation and the lab findings are typical for idiopathic nephrotic syndrome, which is most common form of nephrotic syndrome in children and is often characterized by minimal change disease in biopsy. Glomerulonephritis, choice B, usually presents with hematuria, hypertension, and renal impairment, which aren't mentioned in this case. Hepatic cirrhosis, choice C, can cause hypoalbuminemia and edema, but usually associated with other signs of liver disease such as jaundice. Congestive heart failure, choice D, in children usually presents with respiratory symptoms and signs of fluid overload such as pulmonary edema. Case number 4. An 8-year-old girl with a history of systemic lupus erythematosus presents with edema, proteinuria, and hypoalbuminemia. Which type of nephrotic syndrome is most likely in this patient? A. Primary nephrotic syndrome. B. Secondary nephrotic syndrome. C. Congenital nephrotic syndrome. D. Idiopathic nephrotic syndrome. Of course, the correct answer is B. Secondary nephrotic syndrome occurs in presence of systemic diseases like SLE, which can cause glomerular damage leading to nephrotic syndrome. The primary nephrotic syndrome refers to nephrotic syndrome without identifiable systemic disease, and the congenital nephrotic syndrome is rare and present at birth or soon after. The idiopathic nephrotic syndrome is diagnosed in the absence of an identifiable cause. Case number 5. A 6-month-old infant presents with severe edema and proteinuria. The infant was born at term with no complications. Genetic testing reveals mutation in the NPHS1 gene. Which type of nephrotic syndrome is indicative of? A. Idiopathic nephrotic syndrome. B. Congenital nephrotic syndrome. C. Secondary nephrotic syndrome. D. Minimal change disease. The correct answer is B. Congenital nephrotic syndrome is often due to genetic mutations such as mutation in the NPHS gene and presents in the first year of life as seen in this case. Question number 6. A 10-year-old child presents with swelling around the eyes, especially noticeable in the morning, and the swelling of the ankles by the end of the day. The child also reports recent weight gain. Lab tests show significant proteinuria. Which clinical manifestation is most consistent with this presentation? A. Glomerulonephritis, B. Nephrotic syndrome, C. Acute kidney injury, D. Urinary tract infection. The correct answer is B. Nephrotic syndrome is characterized by periorbital edema and ankle swelling due to fluid accumulation consistent with the child's presentation. The significant proteinuria supports this diagnosis. Glomerulonephritis often presents with hematuria and hypertension, and acute kidney injury typically presents with oliguria, anuria, and elevated serum creatinine. Question number 7. A 12-year-old boy presents with proteinuria, hypoalbuminemia, and generalized edema. He has a history of poor response to steroid therapy and hypertension. A kidney biopsy is suggested. Which factor most strongly indicates the need of biopsy for this patient? A. Age of the patient, B. Poor response to steroid therapy, C. Hypertension, D. Presence of proteinuria. The correct answer is B. A poor response to steroid therapy is a critical indication for kidney biopsy, and especially in idiopathic cases, to determine the underlying histopathology and guide further treatment. While age, choice number A, can influence the decision to perform a kidney biopsy, it is not the most compelling factor in this scenario. Also, hypertension, choice C, suggests a more complicated nephrotic syndrome, but in itself isn't the primary indication for biopsy unless accompanied by other factors like steroid resistance. The presence of proteinuria, choice D, is typical for nephrotic syndrome, and while important for diagnosis, it is not direct indication for biopsy unless other complicating factors are present. Thank you for joining us. Stay tuned for more pediatric case review.